Welcome back. It's a new service being offered here in the tri-state, and it can help people trying to treat skin cancer.
And joining us this morning, Vanessa Mischler of Dermatology Associates of Evansville. Tell us about this new service. It's to really help people that fight skin cancer. There's, higher risk skin cancer. There's lower risk, but explain this.
Absolutely. So this treatment specifically targets basal cell and squamous cell carcinoma, which is actually way more common. And eventually, people always, if you have sun exposure, it puts you at risk for these two different types of skin cancer. So this service has actually been offered for about 6 years now, but not in the tri-state area. So.
Yeah. A 100-mile radius. So this is the only type of service you can get in a 100-mile radius of Evansville.
Correct. So we're very excited to be offering this now. So it's very gentle. They call it the gentle cure. So this treatment actually itself only lasts 45 seconds per treatment. So the treatment, it offers superficial radiation, X-ray therapy. A certified radiologist will actually do the X-ray therapy. And it can take anywhere between 5 to 7 weeks, just depending on treatment. But there's no pain, there's no cutting, there's no scarring, there's no downtime. It heals magnificently.
And you actually answered my next question, what were the other ways? And you mentioned cutting and scarring. So definitely a more gentle way. How did you guys come about wanting this at your office? I know you said it's been around, but we haven't had it here. So what kind of made you guys want to do this?
Yeah, I see skin cancer all the time, every day. And a lot of patients, they might end up with it on their face. And when you tell them the best option is to cut, it makes people really nervous. So we thought, we really should offer this. We really need to be offering something, an alternative to cutting. And, it's just really great for us to be able to do that now.
Absolutely.
Does this match up with most healthcare providers too? I know a lot of times when these new things are rolled out, there's kind of some red tape when it comes to healthcare coverage. So this is something that's covered by most insurances?
Absolutely. And the best part of it is it's greater than 99% effective, which is equal to, if not greater than, surgery.
And I know we've been mentioning your office. We forgot to mention you work at Dermatology Associates of Evansville. You're a nurse practitioner there. Talk to me. You mentioned how you see skin cancer every day. This has to be a common cancer. And what can people do to kind of prevent from getting it?
Absolutely. We're getting into spring. People are going to want to be outside more, as I am too. The best thing you can do is be applying that sunscreen every single day. I even tell patients to put it on their face every single day, even if you're going to be outside for periods of time or not. So wearing at least an 40 SPF and reapplying every 2 hours. If you're going to be outside during the hottest parts of the day between 10 and 2, if you can wear a fishing shirt, something with an SPF, that's even better.
Absolutely.
How can folks get a hold of your office and say they want to take part in this? Is this something new patients welcome?
Absolutely. We always welcome new patients. So they can go to our website. You can actually schedule online now, which is very convenient, indianaderm.com.
And how often, I know you guys, you said it's a new procedure for your office, particularly, have you guys been successful so far in doing this recently?
Yeah, so we've actually been offering it for about 3 weeks now, which is not very long, but we've seen very happy patients already, which is so fantastic. The most beautiful part of this treatment is it's image guided. So every treatment they're coming in, they actually do an ultrasound. They can see the cancer leaving their body, which is so cool. So it repopulates with, it looks like green on the ultrasound, and that's the new healthy tissue coming in. So it's really exciting for patients. They see it on their skin looking better, but they can also see it on the screen.
And of course, having those checkups, because you never know if you have not been to a dermatologist recently. So new patients, you said, can they just call the office?
Yeah, absolutely. They can call or they can go online and schedule that way too. But I always recommend doing a yearly skin check. And if you haven't done one yet, you should definitely start doing them.
Absolutely. Vanessa, thank you so much for joining us today. We really appreciate it, learning quite a bit.